Here we are again. Here we are again. Oklahoma's healthcare system is still on the verge of collapse, and the state's budget remains in a crisis. The time for action is now. Good morning. My name is Craig Jones, and I'm president of the Oklahoma Hospital Association. And I and over 100 of my colleagues from hospitals across the state are here today to urge legislators to pass the most viable revenue-generating measure this session, an increase in the tobacco tax by $1.50 per pack dedicated to health care. 74% of Oklahomans agree with us. The will of the people is evident. It's now time for the legislature to act. What happens if the cigarette tax is not passed this year? Well, the Oklahoma Healthcare Authority, the state's Medicaid agency, is facing a 14.5% reduction in appropriations from the state. And they tell us that that eventually calculates to 24.6% in cuts to the reimbursement rates for healthcare providers under the Medicaid program. Such a cut of almost 25% means that over a dozen hospitals across the state would have to close. And that's on top of the 4 that closed last year. 4 out of 5 hospitals across the state would no longer deliver babies. 9 out of 10 nursing homes would have to shut their doors. You're going to hear from 3 individuals who know what these dire consequences mean for them. They're on the front lines. So let me have them introduce their story to you.
Good morning. I'm Rick Wagner. I'm a healthcare partner with Eide Bailly CPA firm, and I work with rural hospitals almost exclusively. We looked at the numbers this last year. There's 65 designated rural hospitals in the state of Oklahoma. Out of those 65 hospitals, 53 of those last year had an operating loss. 37 of those hospitals have less than 14 days cash on hand. They pay every 2 weeks. It's a payroll. I'm currently working with 7 hospitals in the state of Oklahoma right now that are living payroll to payroll. Every week we decide how we can make payroll this week. If they miss a Medicare or Medicaid payment, their ability to make payroll comes into question. And I know of several other facilities in this same shape. The facilities in these rural communities are often the largest employer or one of the largest employers. They also have the highest pay rate because of the professionals that work within the hospital. These rural communities are interdependent upon each other, the rural community to the hospital, for economic viability of their community. The doctors are also interdependent. No hospital, no doctor. Hospital closes, doctors leave. That happens, you also have a roll-down effect to the EMS service, as often is the rural EMS service. They have to take patients further away. What happens to the coverage that's left behind? What happens to their budgets if they can take patients that far away? Oklahoma could very definitely see more than 10 hospitals, rural hospitals, close in the next 18 months, according to our calculations. Those will not be evenly dispersed across the state. There could be entire regions of the state left with no hospital and eventually no health care. So we join in the Hospital Association and all the hospitals across the state in asking you to support the cigarette tax and pass that to keep these hospitals open.
Good morning, I'm Chuck Spicer. I'm President and CEO of OU Medical System, and that consists of OU Medical Center, the Children's Hospital, and OU Medical Center of Edmond. Building off Rick's comments about the impact of rural Oklahoma and hospitals closing and physicians not being in practice, We see that impact weekly at OU Medical Center and the Children's Hospital. Moms that previously could get prenatal care in other parts of our state cannot get that care and find themselves in our emergency room at the Children's Hospital Women's Service area in preterm labor, delivering a sick baby because they could not access care. This is a true-to-life story that we see daily at OU Medical Center and the Children's Hospital. We continue to see patients that could not get simple pneumonia treated, have that pneumonia turn septic, and take up a room in OU Medical Center that we need for level 1 trauma, we need for complex cancer, and we're having to provide routine care because they cannot get it in their hometown. We treat patients from every one of the counties in the state of Oklahoma, and we see how the impact of an already fragile healthcare system is now crumbling because of consecutive Medicaid cuts. When these patients can't get the care in their hometown, they come to the most complex health system and the most expensive place to get care, a level 1 trauma center, because the type of care we provide is built for those most complex conditions. I urge you to pass the cigarette tax and encourage the legislature to pass the cigarette tax. This is not a problem that's going to go away if we don't have care providers to take care of patients. It also impacts our ability to recruit physicians. We're already understaffed in terms of physicians in our state. Thank you for your time.
Good morning. My name is Nico Gomez, N-I-C-O-G-O-M-E-Z. I'm the President and CEO of the Oklahoma Association of Healthcare Providers, supporting our state skilled nursing facilities and other long-term care professionals. Since 2010, Oklahoma skilled nursing facilities have been on the receiving end of annually $93 million in state and federal budget cuts. It's starting to compound a devastating impact on our state's nursing facilities. Those cuts have consequences. More than 10 years ago, there were 417 skilled nursing facilities in the state of Oklahoma. Today, there are around 300, meaning 1/4 of them have been forced to shut their doors. One reason they have closed is Oklahoma has some of the lowest Medicaid rates in the nation for nursing facilities. And that's a huge problem when you consider that 70% of all the residents in the state of Oklahoma, 70% of the residents in our skilled nursing facilities rely on Medicaid to pay for their care. Each one of those residents who uses Medicaid as that pay source represents a daily loss of $19.45 to their facility. So over the course of a year, the average skilled nursing facility loses more than $300,000 in uncompensated care to provide those Medicaid services. Those losses have taken skilled nursing profession in Oklahoma to the edge of a crisis, and we are looking over that cliff. Even if we don't receive any additional funds for this industry, I predict we'll still see some closures. About 30% of our homes are suffering significant financial losses today and may not make it much longer. If we see even a 10% cut in the Medicaid rate, we go over that cliff. And really, the financial viability is jeopardized for nearly half of our facilities across the state. As was mentioned earlier, we'll probably see a disproportionate share of those facilities in rural Oklahoma close. If we see a 25% cut, we will not have skilled nursing facilities in Oklahoma open to serve low-income seniors who rely on Medicaid. The only homes left will be those who can serve wealthy, private-paying residents. There will not be a healthcare infrastructure to take care of the most vulnerable elderly Oklahomans. I'm giving you the numbers, the facts and figures. However, I never forget, and we must never forget, that behind every number is a person, a valuable person. We have 18,000 residents who are afraid they're going to lose their homes and their medical care. We have 19,000 employees who are worried about their jobs and the residents they love and care for. These men and women, these residents, are vulnerable senior citizens. They've paid their taxes, they've worked their whole lives, and we must treat them with dignity and respect. Make sure they're not living in fear because of the unknowns in the state budget process. One of those residents is a 90-year-old man named Travis Belk, living in Sapulpa, Oklahoma, in a facility called The Gardens. Mr. Belk's daughter is also in a nursing home. His son has serious medical conditions and can't take care of him. So when Mr. Belk first got to The Gardens, he used his savings to pay for his care. Now that those savings are depleted, he relies on Medicaid to help cover his care. This is the kind of man we're going to cut off if we're not able to do something to save health care in the state of Oklahoma. We cannot sit by quietly in our moral society and let this happen when we know there are other options. And one of the ways we can begin to solve this crisis is by raising the cigarette tax. We are here today once again to ask our legislators to pass the tax, save our nursing homes and hospitals and other healthcare professionals, and most importantly, to make sure that residents like Mr. Belk don't need to be terrified every legislative session that his home and medical care may be in jeopardy. Thank you.
Well, I think it's quite crystal clear that this crisis is real. It's affecting everyday Oklahomans every day. Again, we're here to urge the legislators to do the right thing for Oklahoma, to do what Oklahomans want them to do. Pass an increase in the cigarette tax by $1.50 per pack dedicated to health care. You and others across the state can join this movement by logging in to makeokbetter.org. Now, before we answer any questions that you may have, I want to share with you a video player that we are asking and have distributed to our members today. And as they visit with their legislators, it has a summary video of what this crisis means to Oklahoma. And we want to make sure that you have a copy of this as well. So can we distribute these to the press? Okay, I'd be happy to answer any questions and any of my colleagues. No, I don't think so. We were talking about upwards to a 25% cut last year. And the legislature found ways where the Oklahoma Healthcare Authority did not take the cuts that they were talking about. Even so, we still saw 4 hospitals close. We saw higher ed take a much bigger cut in their appropriations, which helped the Medicaid program. But it certainly did not help the mental health agency. They're, I think, shy over $20 million just to keep their normal services operating. All I can tell you is that the Healthcare Authority was asked to put together scenarios from 0% up to, I think it was greater than 14.5%. And the last word was zero in on 14.5%. And so that's what their calculations are based upon. Obviously, we're waiting for what the legislature will do from a budget packet. And I don't know what else we do other than to plan for what is there. Nico?
Let me also just say, even if the Healthcare Authority were to receive the same amount of money they received last year, that's potentially an 8% across-the-board provider rate cut. And for nursing homes, that will close that potentially closes nearly half the facilities in the state. We're in a position where even a 1% cut, whether it's 1 to 25, is 1% too many for many of our facilities to be able to stay financially viable and take care of the residents.
I don't expect a trauma. I think the impact on us is more getting more overwhelmed than we already are. I left the office today, we were at 101% occupancy, meaning we had more people than we had beds to take care of them. We continue to see this influx of patients from rural Oklahoma. We're going to overwhelm an already overwhelmed system. I expect that we would do everything we can to make sure the state's only level 1 trauma program stays intact. That would be devastating to even consider that. My bigger concern is just continue to take care of the overwhelming number of patients that need to come to OU Medical Center that are from rural Oklahoma. I think, any expansion of healthcare coverage we're interested in, obviously. We know not 1 in 5 patients at OU Medical Center today does not have health insurance. And that's a sign of, again, of a worsening of healthcare and a sicker population of Oklahomans. The way we measure the illnesses of the patients we see is case mix index. We saw that case mix index jump 9% in 1 year. And we think largely because of lack of access to timely care. call it a magic bullet. Would it be a step in the right direction? Certainly.
Let me just make a comment that we've missed the window of opportunity that the federal government had where they were going to fund the expansion by 100%. So any movement going forward, as much as we, as Chuck said, would love to see increased coverage, is going to require the state to put up some dollars. And in light of the budget crisis, they don't have the dollars.
Our legislators said the cigarette tax is not a sustainable source of revenue. Are you putting all your eggs in one basket here? Calling for a cigarette tax increase?
Well, the cigarette tax would generate, they estimate conservatively, about $184 million a year. That isn't going to fix the budget situation. That isn't going to fix health care. But it is absolutely the right thing to do for health care in Oklahoma by helping the youth of our state not to take up smoking. So you talk about it being something that is not sustainable. If we can reduce the incidences of chronic illnesses that are due to smoking, we lower the cost of health care. So it's definitely a win-win. There's no doubt about it. Well, I think it all depends upon how they act upon the provision itself, what bill it's put in, what the language ends up being. But everything that we have heard, what we have promoted because of the fact that it does, as I just mentioned, lower the cost of health care by putting the dollars in that mode. But we'll just have to see how the legislature acts upon it. I haven't heard any viable options, but I'm hoping that they're looking for any that are there.
Any other questions? Okay, our speakers are available for one-on-one for this.
Thanks so much. Thank you.